I'm still me. I might get a bit mixed up.
Powerful words from the Dementia Together NI public information campaign. The project aims to help people live well with a dementia diagnosis.
That's dealing with dementia together.
Each health trust in Northern Ireland has a specialised team of professionals who provide invaluable support at the point of diagnosis and beyond. They're called navigators.
When developing our service, we wanted to ensure that families and people with dementia felt supported from the point of diagnosis, and we wanted to make sure that that support was continued throughout their journey with dementia. We wanted our service to take more of a holistic approach to care. We wanted to visit people in their own homes where they felt comfortable. It wasn't a clinical assessment. This was about providing support and providing non-intrusive support. For people to make informed choices, they need to be aware of what is available and how to access services.
The Learning and Development Framework is a structure which ensures all care provision is tailored to the individual's needs.
At the minute I have vascular dementia, MS and fibromyalgia, and I've got children.
20,000 people in Northern Ireland live with dementia.
Liz and I moved in here, because Liz developed Alzheimer's at 47.
Across our health and social care provision, there is a requirement to identify additional needs that dementia diagnosis brings.
And I know that you have expressed wish that you would like to specialise in working in the field of dementia care.
Oliver has just completed his nurse training, his mental health nurse training, and he has also been successful in getting a permanent position here in the Gillis Memory Centre. He's very keen to develop his career in the field of dementia care.
This framework will help me immensely across all the areas and all the sort of levels of staff that we have at Palmerston. So whether it be from the housekeeping staff to the frontline carers, going through to the seniors as well, and right up to my deputies, because it actually gives us that development where they can actually look at it and see their journey and help map out what extra courses that they can do whilst they travel through the different tiers and through the thematic areas.
The framework will set out new guidelines of understanding, taking away the stigmas, and that will mean better patient care in the long run.
Now, they're called Dementia Champions, health professionals who've become the first to qualify.
Another innovation of the project is the Dementia Champions programme, highlighted recently on UTV.
These health professionals are the first in Northern Ireland to have qualified in specialist dementia care. People like Wendy Jackson. She's done it to improve the lives of those she looks after in the Seven Oaks Daycare Centre in Derry.
Oh, I love them. They're great. To see somebody getting something out of their life and smile and not being lonely is worthwhile.
This really gave a very good understanding of what it's like to have a diagnosis of dementia, just how to care for people in a person-centred way, how to involve families and carers in their care, and how to support people.
20,000 people in Northern Ireland live with dementia. That number could double over the next 30 years.
I really enjoy it, and the staff are great, and we can relax yourself, and
there are now 300 dementia champions across Northern Ireland, bringing added expertise to care provided to people living with dementia.
What they've achieved will soon become industry standard. Gareth Wilkinson, UTV Live, Derry.
Dementia Together NI has also funded specialist training where health professionals experience the real impact of dementia on all aspects of a person's life.
We obviously received training around dementia anyway, but this gave a realistic view of how our clients could be feeling on a day-to-day basis.
The Dementia Companion Service reinforces the ethos of personalised care, complementing clinical intervention. The personal knowledge of the patient helps the companion to engage holistically.
Patients would have been admitted to the hospital, and obviously because of the nature of their condition, they always come in obviously terrified, and the nursing staff, good as they were, didn't have the time, they didn't have resources. We can befriend the patients so that we can put them at their ease, and before you know it, you have this wonderful, bond going on.
The companion service not only benefits patients, it also helps staff engage effectively and provides reassurance for families while their loved ones are in hospital.
Some days she'll just close right down and she'll not have too much to say. She'll be like rambling a wee bit. And these guys can sit and talk to her, and the next thing she's up and you can see the eyes brightening up and she's talking away. And they're invaluable.
You can see when they come in and see their loved ones sitting talking to someone rather than just being in a confused state all the time. It gives them so much energy, obviously, and you can see it in their faces. They're happy to be left alone with a total stranger, if you like.
Another investment of the Dementia Together NI project is the innovative Short Breaks for Carers pilot. After engaging with carers and service providers, a number of short break packages were identified to be trialled.
The pilot programme was delivered by Bryson to meet the unmet needs of carers who were living with those affected by a dementia. The impact was significant. It reduced levels of stress, it reduced levels of isolation, and certainly it improved the relationship between the carer and actually the loved one they were caring for.
My mum is Greta and she's 85. She has dementia and I've been looking after her for about 12 years. Mum's very reliant on me or someone else being there. I happened to mention about being 60 and maybe being given a birthday present of a trip to Amsterdam for 3 nights, and I thought, can I go, can I not go? So the care manager, she picked up on that and said, you know something, I maybe have something that will help you here. I was able to say, Mum, I'm going away, but there's someone going to be with you for 24 hours a day, and we will meet them before I go. I can introduce you to them and they will do whatever you need and they will do whatever you want, because it's your house, you're going to be looked after in your own home. It was just invaluable.
Building up a person-centred relationship was key to getting the trust of the carer and the trust of the client. And very, very important if you're providing a short-term break, so that the carer can actually leave their loved one and not be worrying the entire time about what's happening.
Delirium is a medical emergency and can affect anyone. However, certain people are more at risk than others. Those at risk include people over 65, people with a dementia diagnosis, people with infections, and people with a fractured femur.
People with dementia are 5 times more likely to experience delirium.
Meet Frank.
It's a medical emergency which, if treated urgently, has less negative impact on the person.
Frank is an active, independent gentleman of 71 who is currently living alone. Every morning, Frank's daughter Kate calls in for a coffee and a chat. This morning, however, Frank just isn't himself. What were the delirium signs? 1. Frank's behaviour had changed suddenly. 2. His daughter said it was out of the ordinary. 3. Frank had an infection.
The Northern Ireland Delirium Bundle provides resources to ensure there is prompt response to the medical emergency of delirium.
Delirium causes a rapid change in the person's behaviour. You may notice that they are confused, agitated, delusional or hallucinating, or tired or withdrawn. If you spot any of these signs and symptoms, or if you suspect delirium, please don't be afraid to tell someone. Together, we can make a delirium difference.
In line with best practice for engaging with people with dementia and delirium who may be showing signs of distress, they use distraction therapy tools.
So this is a trauma and orthopaedic ward, and most patients are here because they've sustained a fracture. They're aged between 17 right up until elderly, that involve a lot more care and input regarding their management of pre-existing conditions. Prior to the changes, patients didn't have the information available to them and staff didn't have any training on delirium awareness or a delirium assessment tool. So having these changes implemented, it has given staff much more confidence in dealing with patients with delirium. It has created more awareness from admission about the risk factors to the family, to the patient and to the staff. They act on any signs of confusion much quicker and try to find the underlying causes. This has a big impact on prompter treatment, and also it's much more pleasant experience for the patients and their family. We have invested in different distraction therapies, and they're to be personalised for each patient. and we get consent from family members and from the patients that they can use them. We have things like pet dogs, we have books with nice photos and games and balls of different textures and things like fidget blankets. These are used for specific patients and they are a distraction to what's going on in that patient's background.
Another way of addressing behaviours that negatively impact on our ability to provide care is the CLEAR model.
A person living with dementia can often present with behaviours that we find difficult to understand. But a person living with dementia is no different than you or I. But sometimes their communication isn't as effective as our communication is. And what we see is that behaviour is a form of communication. So what we've done within the Northern Health and Social Care Trust is develop Clear Dementia Care. And Clear Dementia Care looks at the whole person with dementia to try to understand what need that person's trying to communicate with their behaviour. And what we've done is we've developed a training programme that offers training to care home staff, and the care home staff then report that they're better able to understand behaviour and they're better able to understand the person with dementia and offer better quality care. So what that does is it improves the quality of life for the person living with dementia. Dementia Together NI then offered us funding to deliver Clear Dementia Care training to all of the other trusts in Northern Ireland.
The Northern Ireland Social Care Council has launched an app with Dementia Together NI to assist staff involved in dementia-specific care.
People who work in social care will encounter people with dementia and their families on a regular basis, and they will be providing care and support for them in a regular basis on a range of settings. It's important that they have the right skills, the right knowledge and the right competency to be able to respond effectively to their needs.
The initial investment in the Dementia Together NI project has produced all of the expected outcomes, improving the lives of people living with dementia. We are delighted that we were able to support other resources identified along our journey.
Well, Jean's friendship means a lot to me, because I know Jean's always there for me, you know, to listen to me whinging.
Well, Evelyn has been a very good friend for a long number of years. When Evelyn told me, I suppose it would be a bit of a shock, but I thought, you're just the same person.
I'm still their mammy. Still me.